price you pay to pursue your dreams. Grinding every day to get that dream. Ain't no holding back until you get your shot. One day you're gonna open your eyes and be on top. That's the price you pay to pursue your dreams. Grinding every day to get that dream. Ain't no holding back until you get your shot. One day you're gonna open your eyes and be on top. Been playing this game since I was 10 years of age. I wanted to make my mark ever since my Pop Warner days. When I strapped that helmet, I'm knocking dudes into a blaze. A lockdown corner going all the way through 7th and 8th grade. Entering high school, I'm ready to write another page. Busting my ass and lifting weights. It's a much higher level, but I'm still making plays. No time to party or bask in my glory days. It's college preparatory classes every single day. Living my life with that singular goal. It's the fire inside that makes me whole. Looking in the mirror, my muscles swole. I'm on a mission, and I'm never gonna stop. When the ball's in the air like Sherman, I'm a hawk. And I promise I'll overcome whatever life throws at me. All right, good afternoon, everyone. Welcome to the Ageless Movement Podcast. I'm your co-host, Scott Lohman.
I'm Sang Pongnak.
Okay, a little bit different format this week. We're actually recording in my recording studio, and the sound quality should be a lot better. We're experimenting here. And it's still going to be a video to you when you're watching it. We're going to have visual aids like we always do, except this time we're going to be in live studio sound quality. All right, so today we're going to be talking about hormone replacement therapy, but what I really wanted to start off talking about was something really important. I don't know if you remember in the mid-2000s someone named Anna Nicole Smith. She was a woman who made herself very famous because she married some billionaire magnate, and he was like 94 years old or something, and she was, 30 or 24 or something like that.
She was also the guest model.
She was the guest model?
Yes.
Oh, okay.
She looks like Marilyn Monroe.
She kind of does look like Marilyn Monroe, except a little more junk in the trunk.
I think junk everywhere.
Yeah, it's okay, though. All right, so a lot of you, well, actually, I'll just pose the question to you, Sang. Do you know how she died?
Not really.
Nobody really knows. They always say, well, it was probably a drug overdose.
Right. Oh, I forgot about that one. Yeah.
While they did find 9 different drugs in her system, it wasn't any drug that killed her. In fact, a lot of people, the coroner initially thought it was methadone, which is something they give to heroin addicts that are trying to come off of heroin. And, it's a transition drug. It's also very hard to get off of and very dangerous as well. It's an opioid. Opioids seem to be our drug of choice in America. And there was a reason why she was taking it, though. Do you know the reason why she was taking it?
I do now.
What's the reason?
There's some mention of a drug overdose.
Okay, so the main reason why she was taking methadone wasn't so much to get off of any drug. It really started with something that happened when she got on a plane on the way to Florida. And what happened to her was she had a bad injection in her, I believe it was the right buttocks, her right butt essentially. And what happened there was she got the infection and she started to develop a fever about two hours after she noticed the infection. And if you could imagine, she's sitting on the plane, sitting on her butt. She goes on like a limo or a taxi, whatever they were driving her around in, back to the hotel. And she was feeling even more pain. So when she got to the hotel and got comfortable there, she was in a lot of pain and she had a high fever. And William K. Stern, who's actually her husband at the time, he's a younger guy because the old guy had passed away. And what happened was she started to develop a fever and a real pungent smell. So there's a lot of sources on this. Most of them are wrong. I remember reading about this at the time, but it wasn't until I read the New York Post, and I'll definitely post that article in the comments section. And what happened there was she had a nurse with her, and I think the nurse started to piece it all together. So she developed a blood infection. And I don't know if you've ever experienced a blood infection before, you know someone that's experienced a blood infection before, but it's a really, really serious thing to have a blood infection. In fact, there's a medical term for that. It's called sepsis. And immediately, if you suspect you have sepsis, you should always go straight to the hospital. And unfortunately, in this situation, she insisted, Anna Nicole Smith, that her nurse treat her with antibiotics when she was a nurse and not, in fact, a doctor. So eventually, what happened was she started taking methadone and a lot of pain-killing drugs, very powerful opioids, to dull the pain from the infection on her glute. Now, you're probably wondering, why would she have an infection in her glute? Why wouldn't she inject herself in her glute? Any reason?
No.
No? Okay, so here's the main reason why somebody's going to be injecting themselves in their glute.
Diabetic.
Well, diabetics can do it in their arm, and it's quite small, but very cute guess. So what actually happened was she was injecting herself with growth hormone. Now you're probably wondering, what? Growth hormone? And this leads to why we're talking about Anna Nicole Smith in this podcast is hormone replacement therapy. And she actually had her own hormone replacement therapy, which was growth hormone.
But why? She was so young.
Yeah, why? Why would somebody so young take growth hormone? She wasn't even 40. I believe she was 39 at the time. I'm looking at the article here. Yep, 39.
And did she already have her child?
Oh, man, you ask tough questions.
I just remembered, now that you mentioned the young husband,
yeah,
I do know that they had a child.
And
he actually raised her. Well, eventually he had to raise her, but it was his child.
Yeah, so pretty interestingly enough, she had a son, and she has a son and a daughter. The son, unfortunately, died of an overdose as well. And if memory serves me right, he died of methadone overdose. I think there was other things involved, like what, antidepressants?
Yep, Lexapro and Zoloft. Oh, Zoloft.
Zoloft, good old Zoloft.
That's right. So many commercials for Zoloft.
Yeah, crazy stuff. Okay, so now you're probably wondering, okay, why was she injecting growth hormone into herself if she's so young? What's the point? Now, to give you some background on this, growth hormone is basically a hormone that's made in the pituitary gland. And the point of growth hormone is it allows for massive tissue repair. So you can imagine when you work out, you recover much quicker because, as we've talked about in other podcasts, myofibrils, otherwise known as actin and myosin protein, that's what you break down when you work out, and growth hormone allows you to rapidly repair. Now, what does that really mean in the practical sense? Why would a young woman who's, for all respective purposes, a model, why would she take something like that? Well, she takes something like that because it will get her very lean. And the other beauty about the growth hormone and being lean is your skin improves dramatically as well. And if you know, Anna Nicole Smith always battled her weight throughout her life. So this was I would say, hormone replacement therapy, part of a program, a weight management program. I don't recommend that strictly for weight management, but she was probably somebody that had a lot of inflammation in her body. And if I had to guess, based on what I know now, she probably should have been eating maybe less carbohydrates, more or less on an anti-inflammatory diet. That would have probably put her in a much better position. But she sounds like a person that was, perfectly willing to take whatever drug necessary to, look the way she wanted to look or feel the way she wanted to feel.
So in a Newsweek article, dated all the way back to 2007, it says, according to the medical examiner, it was a cocktail of anti-aging drugs, including growth hormone, or HGH. Smith repeated intramuscular injections, he wrote, were self-treatment for longevity and weight control.
Yes, that's true. And see, the problem with that is when you say intramuscular, you're talking about a needle that's almost 2 inches long. And when you're repeatedly injecting yourself with that, there is a chance that you could get an infection. Bodybuilders suffer from this as well, and that's why they tend to alternate between their thigh muscle and their glute.
The medical examiner found it as a deep-seated abscess filled with yellow and green pus.
Yeah, isn't that disgusting? And you think she would have went to the hospital and been treated for that, but that infection led to sepsis, which is a blood infection. And that's essentially what killed her. It really wasn't the methadone. It really wasn't all the drugs she was taking, which I have no doubt were taking a toll on her health. But the primary thing that she died of was actually sepsis.
So continuing with this Newsweek article, it says that the body naturally makes human growth hormone, a product of the pituitary, a small pea-sized gland at the base of the brain. HGH is critical for normal childhood development. But by time people reach their 30s, their bodies begin to produce progressively less of it. So a man in his 70s, for instance, may generate only 1/3 to 1/2 of the HGH he used to generate in his 20s. Doctors may prescribe growth hormone injections for patients with abnormally low HGH levels, like people who suffer from dwarfism or chronic wasting disease. But for the most part, declining HGH production is simply part of aging and not necessarily a bad thing, medical experts say.
Yeah, and keep in mind, you can actually stimulate your pituitary's gland production of growth hormone by lifting heavier weight, doing really explosive movements. All those things will actually help stimulate GH growth. Now, will it stimulate it to the point of where it's to the same level that a
20-year-old?
Yeah, or not even that. HGH, human growth hormone therapy? No, it won't. The whole point of human growth hormone therapy is they give you much higher doses. And the higher doses build muscle and get you very lean. Now, if you're a woman, keep in mind, you're going to get much leaner and more shapely, and your skin's going to look better. So I know that's why she was basically taking it. Now, I know some of you probably with good memories that have watched the Olympics and you've gone all the way back to, say, the 84 Olympics. I don't know if you remember watching the Olympics in the late 70s and the early 80s, but many people have, I've seen this in documentaries. I believe 30 for 30 had a documentary on the 84 Olympics, and members of the IOC, the International Olympic Committee, commonly referred to that Olympics as the growth hormone games. Because literally they suspected every single person that competed in that Olympics had high amounts of growth hormone they were taking. Now, you're probably wondering, well, why didn't they bust them? Well, at the time, GH wasn't something that was banned. It wasn't something that was largely known. The second reason is you really can't test for it. Now you're probably wondering, well, wait a minute, Scott, if they knew they each had really high levels of GH, how come they couldn't bust them? Well, there's no definitive test that shows those high levels of GH are natural or are synthetic. And it's the same goes today. And that's why so many NFL football players, so many Olympic athletes, they do experiment with growth hormone because growth hormone actually is very hard to detect and prove. Now, how do they really do it? Well, here's the thing. I'm going to pull this right out of my brain here. I'm not saying this is accurate, but for quantitative reasons, I wanted to just throw these numbers out so you have some idea of what we're talking about here. So let's say, hypothetically speaking, this isn't true necessarily, I'm just throwing the number out. Let's say the average young, healthy male that's a strength athlete makes anywhere from 25 milligrams to 50 milligrams of growth hormone per day. Now, if you give the guy some enhancement, some chemical enhancement, it may be a gram or 500 milligrams or 850 milligrams or a full gram, like I mentioned. That would be proof that, you know humans can't generally produce that much growth hormone. So that's how they try to come after these athletes. Now, here's the thing. If you're an athlete and you know you're going to be tested, guess what? You start to cycle it down, getting close to competition. Now, some of you may say, well, hey, Scott, they do random testing. Yeah, they do. But I guarantee you something. They're not going to bust the most famous athlete in the Olympic Games because that's bad for business. Okay, so I hope did I make myself clear about why she might be using growth hormone?
Yes, and so did Newsweek and the Medical Examiner.
Yeah, good job, baby. And the other thing I can't stress enough is bodybuilders use this stuff all the time because they're taking regular steroids like testosterone. And then when you introduce growth hormone into that mix, suddenly a really big muscular guy is going to be super lean. Now, what are the side effects of high levels of growth hormone? Some of you probably remember the East German athletes of that time period. We're talking early 80s. They were pretty terrifying to look at. They looked very manly. They had foreheads that stuck out and made them look like giants, like Andre the Giant. And you remember the wrestler? He was one of those rare people that naturally his pituitary gland secreted way too much growth hormone. And that's why he was so tall and such a large individual. So same thing happens when you give synthetic growth hormone to people. If you do it for long enough and at high enough doses, you'll start to see an increase in jaw size, an increased forehead size, the nose will start to take a different shape. And it became so problematic that the East German and Russian women, they didn't look like women anymore. And that's where a lot of the misinformation by women in America started to develop, where they thought, well, if I start lifting weights, I'm going to look like these women. When we, in fact, no, you have to take all those drugs for that many years to really look like that. And of course, you got to remember, they were basically chemistry sets for the East German Olympic team and the Russian Olympic team. They were so serious about winning gold medals, they were completely committed to having their women, taking dangerous drugs as well as the men too. Now, what was really bad about the women taking this stuff is women aren't supposed to have this high level of GH and testosterone in their body, but we're mostly talking about growth hormone here. But I can tell you right now, they were also taking testosterone as well. It became so problematic that when many of them retired from competition, guess what they did with them? They transitioned them to men. And you know why?
Nope.
They had a hard time meeting men that, were attracted to them. And the other reason, too, was they were being abused, attacked, beat up by, ignorant men, of course. They were called freaks and things like that. And nobody really knew the reason why these women looked like that unless you had some experience with the sport and with, performance-enhancing drugs. So many of them just transitioned to being men. Now, that creates a lot of ethical concerns, I think, because number one, nobody should ever transition unless they want to transition. Not simply because they're starting to look like a man. You know what I mean?
Well, I guess that's a personal choice.
It is a personal choice, but I don't believe they had a personal choice. I think in many cases, because of what was happening to them, they were just simply encouraged to transition to a male, which is kind of crazy to think about. Anyway, we're not really here to talk about transsexual issues. We're not, but we wanted to paint a picture for you as to what the side effects are. Now, you're probably wondering, okay, that's a really bad side effect. Looking like a man when you're a woman, right? And as a man, having an increased forehead and increased sized jaw, pretty scary. But then you think, well, it's not that big of a risk if you're a male, right? Maybe it's worth the gold medal or 2 or 3 gold medals or whatever you're trying to achieve, right? Winning Super Bowls. That's not the only thing that grows. You know what else that grows?
No.
Everything grows.
Oh.
Your heart, your lungs, valves grow. All your organs, your kidneys, your liver especially, and your pancreas, and it creates a lot of problems. In fact, there's a term called steroid gut or growth hormone gut. And what that basically means is the abdominals become distended. So even though you look like you can see a six-pack, you clearly see pure muscle there and not really any fat. But because there's so much swelling in their organs and their whole midsection sticks out like a waffle iron. Now, sometimes people look like that because you're eating a lot of calories, you're lifting heavy weight. That's pretty much how a bodybuilder looks like in the off-season. They have a lot of offensive linemen may look. But when you really look at it and you start to see the swelling there, this happens with alcoholics. When they drink for too many years, you'll see a distended abdominal area, mostly because their organs are swelling up. And that's another reason. Pretty crazy, huh?
Yeah.
So that's a reason, one of the main reasons why you don't want to abuse growth hormone. Very dangerous long term. All right, so anything you want to add to that, or we should transition into the next part of this?
Well, I thought you were going to talk about the fact that once you get on it, you cannot get off.
Okay, I was going to touch that more, talking about testosterone replacement for males. I think we should probably transition to women right now.
Oh, okay.
Sound good?
Yes.
Okay.
Ladies first.
Ladies first. Ladies first.
So for the ladies, my reference is going to be the Mayo Clinic that talks about hormone therapy. And you can take medication to replace estrogen that your body stops making during menopause. So most of us, that's kind of the time frame that we're talking about, potentially looking into this. And hormone therapy is most often used to treat common menopausal symptoms, including hot flashes and vaginal discomfort. So there's there's some basic types of hormone therapy. There's systematic hormone therapy, which is systemic estrogen, comes in a pill, a patch, a ring, a gel, and many other forms. The list is a little long. And then the next one is going to be a low dose vaginal products, also cream, tablet.
And that's mostly
ring.
for moisture, right, for women?
Correct. Or, I guess it could also be sensitivity.
Yeah, that's true, but you would think with enough lube there, that would help with that.
But, no, I meant like all day.
All day, gotcha. See, I've never been a woman. I'm going to shut up now.
Also, if you haven't had your uterus removed, your doctor will typically prescribe estrogen along with progesterone or progestin. And this is because estrogen alone, when not balanced by progesterone, can stimulate growth of the lining of the uterus, increasing the risk of endometrial cancer.
Wow. So that's why they want that progesterone estrogen balance.
Yes. But, if you keep digging into this, I think ultimately it's one type of cancer or another type of cancer. So.
Yeah, and that's where you basically have to ask the question, what would be your motive for engaging in any type of hormone replacement therapy? Because obviously you don't have the knowledge to completely make that decision yourself. You're going to consult with your doctor. And the other reason is, there could be other reasons that would mitigate the risk. So let's say maybe they look at your family history, with disease. They can look at your genetics. Maybe you're not high risk at all for cancer. Maybe you're low risk. So it may be worth it. Maybe you're a person who has very low bone density, low muscle mass, and you find that you're just, you're spiraling downwards, and you could see, with the fact that they can do bone scans. I think they do them every couple years if you want. I had a couple clients that I worked with that were women that came to me for that specific reason, to build bone mass, and they asked me, can I build bone mass without having to take Fosamax and all these other drugs? And I said, yeah, you can, but it's going to require lifting heavy weight, and you can't lift a heavy weight overnight. We got to build up to that point, and you got to look at this through a number of years. I said, if you can just stop, the regression, so to speak, keep it where it is, or maybe improve it a little bit, that's a big victory. Well, I can honestly tell you, with two of my clients, I had one client in the early 2000s I worked with for about 5 years, and she dramatically improved her bone mass. Then I had one woman who came to me for the same reason, and I told her the story about my first client. I'll just say her first name. Her first name was Tiki. And Tiki made a pretty dramatic difference in her spine, in her pelvic region with bone mass. And I told the story to Mary, who was my other client I got years later. And I worked with Mary for 6 years. And guess what? Mary made even more progress. So they basically took, calcium supplements. But the calcium supplementation isn't really going to help without the weight-bearing activity with it, because that's what allows the calcium to deposit in your bones and allows your bones to do what we call bone remodeling. which is building bone mass. So there are benefits for some people to take some type of hormone replacement therapy. I call it HRT. Others, I think it's kind of trivial. They're doing it for, visual purposes, cosmetic reasons, and they're putting themselves at risk, clearly, especially if you have a cancer history.
So going back to the risk of hormone therapy for women, we did forget to talk about some of the other risks include heart disease, stroke, blood clots, and then earlier we briefly mentioned breast cancer.
Yeah, and what we're getting, if you read this article too, it's from Harvard Health?
Mayo Clinic.
Mayo Clinic, sorry. The other one was Harvard Health. Yeah, Mayo Clinic. And what you have to understand is if you are seriously considering hormone replacement therapy and you are a woman, you're better off starting it sooner than later, because if you wait till, say, around 60 years of age, according to the article, it's going to be much higher risk for you from all these hormones like cancer. So I would talk to your doctor about that if you're serious, and try to get that going within that 10-year period of going into menopause.
So the people who can benefit from hormone therapy are people who have moderate to severe hot flashes or any other symptoms of menopause. We've already discussed the need to prevent bone loss or fractures. And then also if you're experiencing early menopause or having estrogen deficiency. So if you take hormone therapy, how you can reduce risk is talking to your doctor, of course, and figuring out the best way to get therapy. Minimizing the amount of medication that you take, which I think overall we find most people we work with take so much medication.
Yeah, that's pretty common. Polypharmaceutical issues definitely increase your risk for anything else that you're taking.
And then the other thing is seeking regular follow-up care, which I find to be very crucial and hard for a lot of my clients to keep up pretty regularly, because it definitely requires a partnership with a medical professional and not something you just stay on and never have the discussion going forward. And then making healthy lifestyle choices. So it includes physical activity and exercise in your daily routine, eating a healthy diet, maintaining a healthy weight, not smoking, limiting alcohol, managing stress, managing chronic health conditions such as high cholesterol or high blood pressure.
Yeah, makes sense.
So what can you do if you can't take hormone therapy? And basically, if you're looking for hormone therapy, chances are you're trying to manage menopausal hot flashes, which can be done with a healthy lifestyle approach, such as keeping cool, limiting caffeinated beverages and alcohol, and practicing paced, relaxed breathing or other relaxation techniques.
Yeah, it's always the same thing, isn't it? Stress reduction, plenty of exercise, especially intense exercise is good too, and limiting alcohol, caffeine, coffee specifically, drinking more water. Those are all things that will benefit your body, no question about it.
Yeah, and I know a long time ago, it's probably been like 5 or 6 years now. A while back, I did take a class with a functional medicine practitioner, and she basically discussed like the healthier your lifestyle is, the easier menopause actually becomes. So if your lifestyle is healthy, then you should basically kind of be able to breeze through menopause. And I mean, that's always been my hope. And if I get to that point, I'm probably going to work with a functional medicine doctor to like dial it in rather than...
Yeah, and I think too often, because of all the advertising that you see on TV, especially for males, it's probably more prevalent with men. But you see it with women too. The first thing they want to do is jump to a hormone replacement therapy program without even, carefully considering the lifestyle choices, especially when you're talking about exercise and pretty radical changes to your diet. Just the difference of eating foods like avocado can make a big difference in the amount of inflammation in your body, which has a dramatic effect on the amount of not only testosterone if you're a male and even a female, because women need testosterone as well, but growth hormone. All of those foods are very crucial to, maintaining a healthy balance in your body. And as we all know, one of the major causes of health issues and disease is the situation where your body becomes physiologically out of balance. Okay, let's move on now to why men seek out hormone replacement therapy. And just for kicks here, as a woman's perspective, why do you think men oftentimes seek hormone replacement therapy?
Well, my perspective isn't necessarily a woman's. It's
well, tell me.
I have experience where I have a client whose son got, he actually does testosterone early on, and I think because he knew he tested for having low T, and then decided he wanted to get onto testosterone. And this is somebody in their 30s, and of course my first remark was, well, once you get on, you'll never be able to get off. So that's definitely, 30, what is that, 60-year investment into this?
Yeah, and that's something I want to touch on as well when we talk about the reasons why men will engage in hormone replacement therapy. You hear a lot of the same typical answers as to why, and it made me think of this article by Harvard Health Publishing, Harvard Medical School, and of course we used this journal last week for our last week's podcast. And like I was telling you, these articles are great. They're written for the average layperson. They're not necessarily written for doctors or people deep in the medical field. So I'm going to go over some of the things that the article talks about, but basically the name of the article is Testosterone Therapy Safe? Take a breath before you take the plunge. And like Sang says, once you go down this road, you really don't have a lot of options of getting off of it at that point. So I want to go over what some of the things are that they're saying in the article. Millions of men use prescription testosterone injections or gel. Those are forms of testosterone. They often are referred to as, of course, TRT therapy, which I use all the time, to restore levels of, hormone replacement therapy that kind of mirror what the average male would be about that age, okay? So a lot of people feel when they use the treatment, they're more alert, they're mentally sharp, they're physically stronger, they have more endurance, and of course, their libido increases. Now, this is interesting. I want to read you this quote. Because of marketing, men have been flooded with information about potential benefits of fixing low testosterone, but not with the potential costs, says Dr. Carl Peleus, an endocrinologist and assistant professor of medicine at Harvard Medical School for Men. Men should be much more mindful of the possible long-term complications. Now, what are the basic signs of low testosterone? Well, you see this all the time. From the mental perspective, there's depression, there's reduced self-confidence, there's difficulty concentrating, and disturbed sleep. Now, disturbed sleep seems to be a common issue in all of this. The other thing is you'll see a declining of bone mass, increase in body fat, fatigue. This is a good one here. Swollen or tender breasts. I tend to call them pecs on men. And flushing or hot flashes. Yes, men can get, men can get hot flashes. The other thing is, of course, sexual dysfunction, lower sex drive, fewer spontaneous erections, and difficulty sustaining erections. Those are all signs possibly of low testosterone. But what they don't always tell you is you have to explore all the other avenues that could be causing these symptoms. If you're just depressed, that can do one of two different things. It could make some people oversex, But the majority of males, when you're depressed, you're going to be less sexual at that point. And that could all have to do with more or less psychological problems. So getting psychological therapy should always be your first step. Because like I said, once you start getting on testosterone, it's hard to get off, because when I want to explain it quite simply, what happens to the body. So the reason why when you get on testosterone, your body, whatever testosterone it's making, if it's low, will stop making testosterone altogether. And you probably wonder, well, why, Scott? How come? That's the way the body is. If you're getting it from a foreign source and it's doing the job, then what inevitably ends up happening is your own testes stop producing testosterone. And that's why when people come off anabolic steroids, they'll experience a lot of crazy issues. And one of the main issues is you never want to completely withdraw from steroid use. You want to slowly come off. And then what always inevitably happens is when you take testosterone, and let's say your testosterone levels 4, 5, 8, or 10 times higher than it would normally be, guess what also goes up?
Estrogen.
That's right. Estrogen goes up too. And because like testosterone plays an important role with women's health, the estrogen also plays an important role with male health. So one of the things estrogen is responsible for is a healthy cardiovascular system. So what you don't want to do is start messing around with that delicate balance of testosterone to estrogen. But here's what happens. When you start taking high doses of testosterone, and then even if you slowly cycle off of it, guess what? Your estrogen levels are going to stay super high. And it's going to be a period of time before those estrogen levels come down. And that's where men will oftentimes experience what's called gynecomastia. Gynecomastia, I can never say that right. Gyno is the short term. Having breasts like a woman. In fact, men in the locker room will use the term bitch tits. I had to throw that out there because that's part of the lexicon. So how do you prevent that? You take something called, I'm trying to remember the name of it, HCG, human gonadotropin. Now this is going to really make you laugh, ladies that are listening out there. HCG is actually something that's produced in your own urine when you're pregnant. So when women are pregnant, there's high amounts of HCG. So what they do is they extract the HCG from pregnant women's urine, and they package it for men that are coming off of testosterone, because when you inject HCG, what that does is that brings your estrogen levels back down to a reasonable level, because your testosterone level is down to a normal level, or even probably a below average level. And what eventually ends up happening is your own body starts to produce more testosterone again, and then you get back into a more normal balance. But here's the problem. All those benefits you got from the testosterone replacement therapy, now that you get off the testosterone and you take those steps like I mentioned, including coming off slowly and using HCG, all those benefits you got, like increased muscle mass, increased vigor, higher levels of libido, that all goes back to where it was before you started it. So that is why, and this is something you may not know, men that are on testosterone for very long periods of time, like professional athletes, strength athletes, world's strongest men, offensive linemen and linebackers and defensive linemen in football, if they've been on those drugs since their 20s, mid-20s or late 20s, all the way until they retire, oftentimes it's 20 years of drug use, or at least 15. They cannot afford to come off of it, because if they come off of it, guess what? They're not making any testosterone, or very little. And they have to live the rest of their life at what they call TRT levels, testosterone replacement levels. And what that basically means is a very moderate dose of testosterone throughout the rest of their life. Because if they try to come off, then they'll experience all those things I just mentioned. Okay, what I always, basically the gist of the article we're talking about here from Harvard Health is, a large definitive trial for hormone treatment of men is still to come. So we don't really have this yet. Until then, here's the basic take-home message is approach testosterone therapy with caution. And the idea is that you don't get addicted to, I shouldn't say addicted, but you don't put yourself in a situation where you have to be on these drugs the rest of your life, because that can be very problematic. So how do you know? Well, first you take stock of your own health. You have to consider the other reasons why you may be experiencing fatigue and low sex drive, and other symptoms can be attributable to low testosterone. So, for example, do you eat a balanced, nutritious diet? Do you exercise regularly? See, these are all things you should consider. Do you sleep well? If you're having trouble in these areas, there may be a physiological reason outside of low testosterone that could be the cause. And you have to understand, it's like if you have a major problem with the engine on your car, simply changing the spark plugs weekly is not a long-term solution. And it's the same thing with your own body. The other thing that's very interesting is it could be psychological problems or emotional problems that you're suffering from. Maybe your sex life is not what it used to be because maybe you haven't taken a deep enough dive into your own relationship. Maybe there's problems in the relationship, and it'll oftentimes manifest itself in sexual problems or psychological issues that can be contributing to it. Human beings oftentimes relive trauma. It's very common. And sometimes intimate situations will bring out that trauma, and that can cause dysfunction in sexual performance. So those are all things that I think men need to talk about more. It's very hard for men to talk about that because, I'm a man and I don't have any problems like that little wee guy over there, right? That's the mentality a lot of men have, where I think women are much more willing to talk about these issues, not only with their man, but with themselves. Because there are other, sexual issues with women, like specifically having orgasms or not. Women, I think, are much more likely to discuss these problems because women just emotionally know how to take care of themselves better than men, whereas men, we tend to clam up, especially with the ones we love. And that can be very problematic within a relationship. You always want to have an accurate assessment of whether or not you have low testosterone levels. And of course, you're going to want to have a lab test to identify it as a problem. And, maybe your deficiencies at a certain time, like in the article, they talk about how sometimes men's testosterones are low between 7 a.m. and 10 a.m., right? In fact, testosterone levels are usually at its highest between 7 a.m. and 10 a.m. That's the peak, okay? Confirm a low reading with a second test on a different day. So that's something really important to consideration. You may want to have your testosterone measured between 7 a.m. and 10 a.m. Also, you want to have multiple tests. Don't just rely on that one test because sometimes tests aren't accurate, and that can be problematic. After starting the therapy, you'll want to follow up periodically with testosterone checks and other lab tests to make sure the therapy is not causing problems with your prostate gland. Now, there's the other problem. There's a reason why men and women produce less hormones as we get much older, because our bodies are much more susceptible to cancer. And men specifically, prostate cancer is a real problem. So you want to make sure that if you're on testosterone therapy, you're measuring your PSA levels, and you want to make sure that you're not rapidly accelerating prostate cancer, because that's a very treatable cancer, and you certainly don't want to do something to cause it to grow suddenly. Because you have to remember, like we mentioned earlier in this podcast, growth hormone specifically, but also testosterone, creates an environment where tissue will repair quickly. Now, the benefit of that is, you build muscle very quickly, you recover very quickly. The downside of it is everything else can grow in that environment as well, including cancer. So, you're probably wondering right now, I've had people ask me this before, do you ever wonder, saying, why people really take steroids, athletes? Performance, huh? But what is it about performance that you think they really help with?
I don't know.
Recovery. So you're definitely going to recover at a rate that you're just not going to recover naturally, even if you're really young. And one thing I want to point out, there's been several studies that prove this. So if you take a healthy young male or a female, same thing, but somebody healthy and very physically fit, but I want to talk about men here since we're on the men's section, and you do very heavy weightlifting, what'll happen, you'll secrete natural levels of growth hormone from the pituitary gland and from the testes. Testosterone levels will increase, but you have to follow a careful model. And what I mean is this: if you go to the gym every day and you lift really hard for an hour, and I'm not including warm-ups and cardiovascular training, I'm talking about the actual lifting. You keep that to an hour, you want to leave that gym where you have boosted testosterone and growth hormone levels. And this has been proven in many studies where people have gotten blood tests in the middle and the beginning and at the end of workouts. And what they found with people that are not taking steroids or performance enhancing drugs like growth hormone is that after you get to that 1 hour point and you're still lifting heavy weight, testosterone levels start to decrease. And what does that mean for recovery? It's bad. It means you're going to go from an anabolic state to a catabolic state. And what catabolic basically means is you're actually going to lose muscle because you're training with lower hormone levels. And that does not help with the recovery process. Now, one of the interesting phenomenons of performance-enhancing drugs like testosterone and growth hormone is that it's somehow, there's two things that really happen. So when you're natural, your testosterone and growth hormone levels will start to drop around an hour. For some people, it may be 52 minutes or 48 minutes, but within an hour is where that's the safe zone of when you should wrap it up. Now, what also happens during that time? Anybody ever heard of cortisone? That's a form of steroid too. But it's a bad form of steroid because it does just the opposite. It doesn't build muscle. It actually can make you lose muscle. But it has one really good property. You know what it is?
No.
Anti-inflammatory. So your body actually produces anti-inflammatories, which helps you recover, right, from workouts. Now here's the problem. If you're one of those people that goes way beyond an hour and you're still training really hard, your body senses trauma. And when it senses trauma, it starts producing high amounts of cortisol. And the cortisol will have an adverse effect on your muscle recovery. Now, when that happens, you're going to lose muscle and you're going to start spiraling downwards. And for a lot of people, they know this phenomenon. It's called overtraining. And there's a lot of signs and symptoms of overtraining, and I don't really want to get too far into that. But just so you know, yeah, you'll feel excessive soreness when you shouldn't. You'll feel fatigue. You won't feel energy for your next workout, and you'll notice a loss in weight or a loss in muscle mass. Now, you know one of the great things about steroids for athletes that are using in performance-enhancing drugs is it actually inhibits the body's tendency to produce cortisol. So that's what happens to natural athletes. You start producing cortisol, you put yourself in a catabolic state. But when you're on these performance-enhancing drugs like testosterone and growth hormone, it inhibits your body's ability to produce cortisol at that 1 hour point. So what does that mean? You can train 2 hours of heavy lifting if you want, if you're on these drugs, and you recover just fine. You still have a high anabolic state, which means muscle building. You don't ever get to that catabolic state if you're eating properly and resting properly, i.e. getting enough sleep. And it just gives you this incredible ability to recover and keep moving forward. And that's why I think nowadays you see so many older athletes that can perform at such a high level. I mean, the first one that comes to mind is Barry Bonds. You look at Barry Bonds, he hit more home runs in the later part of his career than he did the earlier part of his career. And if you look at him, his body completely changed. Now, I'm not here to accuse Barry Bonds of anything that I'm not accusing everybody else of doing in that sport, in professional sports. I'm just trying to get you to understand the reasoning why athletes at that level have to turn to performance-enhancing drugs, because it keeps them healthier and they can recover quicker from their workouts. Now, there are some downsides. If you start doing this for too long, or you start using these drugs, at too high of a dose, what happens is the tendon strength can't keep up with the contractile protein strength in the muscle. And that's why you hear about some of these crazy injuries like torn pecs, an unusual amount of torn Achilles tendons in younger athletes, which isn't very common. And I'm not going to say every person that tears a pec or ruptures their Achilles tendon was using steroids. I'm just saying that can happen. And proper training, of course, will help prevent that as well. So the take-home message in all of this is, if you ever are seriously considering hormone replacement therapy and you're a male, I think you should wait for a very long time and first rule out what all the causes are that you're experiencing. If it's low libido or high fatigue, maybe you're depressed, maybe you just don't have a lot of zest for life. Those could be psychological reasons and not necessarily hormonal reasons. And the reason why I'm mentioning this with men is there is so much advertising about low testosterone, and they take advantage of men because men get out of shape when they're older, especially in 40s and 50s, and they want to look to some supplement to fix that problem. And unfortunately, most of the supplementation that you see that's over the shelf does absolutely nothing. And in some cases, it can actually harm your health because it could interfere with other medications that you're taking. And you got to remember, supplements aren't really regulated by the Food and Drug Administration. So there's just a real soft touch from the government in terms of what you can do with supplements. And the supplement industry has fought hard and hired lobbyists to prevent Congress from passing more stringent laws regulating supplements. So try to find out, what your reasoning is, what the reason is behind your lower libido or your lower energy levels. And it may just mean eating better and exercising that fixes that problem. Because we're not talking about professional athletes here. We're just talking about regular people. And you want to be able to function like you did, years ago. But keep in mind, we do get older. We do experience physiological changes, but that doesn't mean you have to give up on life and accept the fact that you're supposed to be a low performance individual the rest of your life. And that's just simply not true. So anything you want to add to this thing to conclude what we talked about today with hormone replacement therapy with men and women?
I think the only thing for me is what you don't get in these advertisements is the fact that once you go on, your body then feels like it doesn't need to produce these hormones. So that's the issue, and it's not something you can just casually go, oh, let me try it. It's definitely a commitment. And I think a lot of times people have the opportunity, if they change their lifestyles and improve it significantly, they should be able to manage the hormone issues. And I use the word significantly because, my clients all the time will tell me all the things that they want to do, and it's counter to what I think the body is capable of. I mean, none of us are superhuman, but yet we want to eat even just today I was reading something by I think his name is Dr. Chatterjee. He's a well-known doctor.
I think I've heard of him.
Overseas, from the UK, where basically saying, we use food as therapy, and it shouldn't be that way. We should... Like emotional therapy is what you mean. Correct. Yeah. So we should eat to live and not live to eat. And that's a really important thing that I feel like most of my clients, and I could say a good percentage of my clients and even people I know, that's not the case. Food is there to console them. And so the food choices are not the best. So it's not surprising when you end up traveling down this rabbit hole of issues. So, one is just trying to, like I say, I've said it in the past, is trying to be the best version of yourself, And I'm not saying that you can't do anything. It's definitely all in moderation, and I always use the word, you got to get to homeostasis. The body's always looking for homeostasis. For balance, yeah. So you have to decide, if I'm going to drink this, how is my body going to recover from it? So that's just the way I see things. So like I said, always trying to figure out the most natural way to go about self-care for me is always the priority, which also includes and I only have one client who does see a therapist, and I always tell him to go work with his therapist on different issues, because there are some things like I cannot tackle and I cannot tell him how to do things. He has to be willing to do them. And that is just one thing that as a personal trainer, I don't know that I can help much. I can only give some advice, but ultimately it's that individual's decision to make these choices. And so that's the thing. If only one out of, all of my clients actually see a therapist, how many are missing that aspect of life that needs to be worked on? So.
Yeah, that's really wise advice.
Yeah.
All right, so I don't really have anything else to say other than to make sure that you've exhausted all of your avenues before you go down the hormone replacement therapy path. I think it's appropriate for some individuals that have physiological problems that can be solved with hormone therapy, but for somebody who just wants to put on more muscle or have more energy or look better, that can be done with exercise and proper diet.
And sleep.
Sleep.
Sleep is another thing that people are missing out.
Yeah, and you produce more hormone when you sleep, huh? Yeah.
And then breathing.
Proper breathing, yeah.
Is the other thing that I think a lot of us miss out on.
Yeah, good point. All right, so don't forget, I know I didn't mention it yet, don't forget to like and subscribe to our channel. It really helps the algorithm. Leave a comment if you have a question. Leave a question in our comment section, rather, if you have a question. And you could always share our video. You just simply click where the like button is just above, and you can share it with a text message or an email or on social media, Facebook or Twitter. Okay, I hope you enjoyed this podcast today. We're going to come back at you soon with another topic. Anything else you want to add, Sane?
That's it.
All right, we're on our way out, everyone. We'll see you in probably about a week. All right? Or maybe 2 weeks.
2 weeks.
Yeah, 2 weeks. Okay, everybody. Take care.